In this video, we'll discuss about quality control in clinical laboratory. Quality control is the one of the important aspect of total quality management. So it is an important aspect of total quality management system in a clinical laboratory, and main emphasis of quality control is to monitor precision, accuracy of performance of analytical method. So main emphasis of quality control is to monitor precision and accuracy of performance of analytical method. Quality control in clinical laboratory will be discussed in three parts. First part will include quality control basics. In the second part, we are going to discuss about quality control statistics. And the third part will discuss about Levy-Jennings chart and Westcott rules. So what are the three important part? Quality control basics, quality control statistics, and Levy-Jennings chart and Westcott rules. So let's begin with the part of that laboratory quality control basics. So what is quality control? It is a process designed to ensure reliable test result. Reliable means trustworthy. So it is a process designed to ensure reliable test with the use of control and standards to ensure accuracy. So with the use of control and standards to assure accuracy, ensure accuracy, and reject result when there is evidence of error. Reject result when there is evidence of error. So the three words are very important in quality control. So with the use of control and standards to ensure accuracy and reject result when there is evidence of error. So these three words are very important in quality control. That is reliability, which is also called as reproducibility or repeatability, or precision. So the precision, accuracy, and the rejection of error, these things are vital for quality control in a clinical laboratory. It is a statistical process. Why it is called statistical process? Because it make the use of various statistics to see whether the results are accurate or precise and whether there are error during the analytical process of the laboratory. So it is called as statistical process. So this quality control monitor and evaluate the analytical process that produce patient result, and that result should be accurate and reliable. Quality control monitor and evaluate the analytical process that produces patient results, and the result should be accurate and reliable. What are the objectives of quality in laboratory? What are the objectives? So clinical biochemistry tests are important to support or reject any provisional diagnosis, to monitoring the recovery or following the treatment, or to screen the latent disease in apparently healthy individuals or to detect toxic effect of the treatment. So monitoring diagnosis to monitoring recovery or following treatment or screen latent disease or to detect toxic effect of treatment. So the analytical result are very important in monitoring medicine, and the objectives of quality is to support the provision of high quality healthcare, which in turn reduce the morbidity, mortality, and economical loss. So this one will reduce morbidity, mortality, and economical loss. And the quality control also ensure credibility credibility of the lab, that particular lab is giving reliable and accurate result. It will give reliable and accurate result in generate it generate confidence in laboratory result with both the clinician and the patients. This quality in the laboratory system or the accurate or precise result will generate confidence in the consumers, which we can say the patient or clinicians. And in addition to that, it also give laboratories to a staff confidence in their method. So these are the objectives of the quality in the lab. How this reliability is ensured? This reliability is ensured with the regular testing of quality control product along with the patient samples and comparison of quality control result to the specific statistical limits that in ranges. During laboratory, in the clinical biochemistry laboratory, the analytical system comprises of many factors like maintenance of temperature, technician or personnel doing the test, instruments itself, technician or personnel doing that instrument, personnel doing itself, the washing condition, the reagent and the control material, the storage. So all these things make the analytical system potentially unstable. We cannot guarantee that every day the analytical system is stable, because there can be variation in temperature, um, there can be any error in the instrument, hardware or software, changes in the personnel doing the test can also result into that errors. Potentially unstable system. Now how to identify the system is unable? So it is done with the use of stable monitoring system, and this stable monitoring system is a part of internal quality control, and it use the quality control material, and this stable quality control material are used to identify the instability in that analytical system. We use quality control product to monitor the unstable analytical system. So these quality control product we use daily in the laboratory before processing of patient samples. So the quality control product, what are the quality control product? These are the patient like material. They are ideally made from human serum, urine, spinal fluid, and other and these control product can be a liquid form or freeze dried lipolization form, that is called as lipolyzed material. means it is in like a powder form, and before use you have to add diluent to it and make it liquid, so we can get quality control product in like liquid or freeze dried form. So depending upon that procurement of that laboratory, the both quality control and the product are available, and the both quality control product have certain advantages and disadvantages. And this quality control product is a product which is composed of one or two constituent or analytes of known concentration, means this quality control product has can have many constituent like it can have glucose, albumin, bilirubin. um, it's all clinical chemistry analytes. It can have the concentration of that particular analytes presented in that quality control material is known to us. It is provided to us by manufacturer. There are two type of quality control product. One is normal control product and another is abnormal control product. So normal control product containing normal level of that analytes being tested. For example, blood glucose concentration range from 70 to 110 milligram per deciliter. So the normal control product will have the concentration for analytes within that normal range. So with the help of that normal concentration product, you can monitor that patient result which are in the in that normal range. And what is the mean by abnormal control product? It contain the analytes at a concentration above or below the normal range of the analytes. Means this abnormal control product, you can say it is like the below of the normal concentration, and it can have above the normal concentration. So the abnormal control product is able to detect the errors. If the patient sample is having the result which is less than normal or the result which is more than normal, so in a clinical laboratory you can have three type of control: low, normal and high control. But most of the laboratory uses only two: normal and high control. A good laboratory practice required testing normal and abnormal control for each test and at least daily to monitor the analytical process. Now let's understand some important quality control terminologies which have been talking like accuracy and precision. What is accuracy? It is closeness of the result. It is closeness of a result to the actual value, which is also called as true value. Means, for example, plasma glucose concentration is the actual concentration is 100 milligram percent. So it should show the accurate result. The analytical system should the actual result that is presented in the sample of that patient, so that is called as accuracy. What is precision? It is also called as reproducibility or closeness of that value to each other, or repeatability. Means if I am repeating the sample again and again after sometimes, means for example 9 a.m. I process the sample, again 10 a.m., again 12 and 2 p.m. So if I am repeating the process of that sample, same sample, the value that is get should be close to each other, then only I can say that it is precise. They are precise value. There is repeatability is present, and when you can say the values reproducible. For example, in one laboratory you are getting plasma glucose concentration 100 milligram per deciliter, and in the other lab you are getting 200 mg per deciliter. So are the result reproducible? No. So means that there might be some error, so the result are not precise. So the result to be precise, it should possess repeatability as well as reproducibility. What is inaccuracy? It is also called as bias. It is opposite of accuracy. It is a measure of systematic error presented in the analytical system, and impression in is opposite of precision. It is a measure of dispersions of random error. Now we are aware about two important terms, that is accuracy and precision. The lab result should be both accurate and precise. So let's try to understand the accuracy and precision with the help of that pictures. So let's us consider this yellow part is our target, and this yellow part is actually in the analytical resource term it is our true value. So here you can see that all the hits, that you can see here is the yellow point. Yellow point means everything you are hitting the target, you are getting the value near to that true value in that yellow circle itself only present. See, so you can see that your result are both accurate and all the value are close to each other, means they are precise. So all the result here are both inaccurate as well as precise. Now discuss about second diagram. Second diagram, all your result or all your hits are close to each other, but they are not near your true value, not in yellow part. They are not at that center, at the bull side here, not in yellow color side here, this one near that. So those they are precise, they are not accurate. These are precise, not accurate. So this result show inaccuracy. Through this precision is there, so it is the indicative of systematic error. Next, third picture, what you see here, all the target or all the result that we obtained, they are near the true value. Near the true value means around the true value, some three result are within the yellow part, okay, within the blue part, that blue eyes. So and some are around the yellow part, so we can say the result are quite accurate, but are they precise? No, this one not precise but accurate, because they are not close to each other. So you can say those result are accurate, they are imprecise. So there is reproducibility error. In the fourth diagram, what you can see, all the result are like this dispersed. They are away from yellow part. Only one result is at that center. Okay, one or two result in the true value, and all the result are not also close to each other, so they are not precise, and all the result are not around at the true value, not around at that yellow on a bull side. Okay, so here the result is inaccurate as well as imprecise, inaccurate and imprecise. So after understanding about the accuracy and precision, let's try to understand about that sensitivity and specificity. The sensitivity and specificity can be analytical or it can be diagnostic. For example, when you can say that the particular method is analytically sensitive, so if that assay, the sensitivity is the essence ability to detect very low concentration of a given substance in a biological specimen. For example, any specimen is having the particular analyte, for example, protein is present. So, it's present in a very low concentration, so that method is known as sensitive. Only it is able to detect that lowest concentration of that particular analytes. So if any method can detect lowest concentration, then you can say it is more sensitive. So smallest concentration, then you can say it is more sensitive. Smallest concentration can be accurately measured by any assay, that is called as analytical sensitivity. Next, what is specificity? It is referred to the ability of an assay to measure a particular substance rather than other in a sample. A method ability to measure only the analytes of interest. For example, you have performed the estimation of blood glucose by Jodie-Fury method. So this protein oxidase peroxidase method is a specific for estimation of glucose presented in the sample. It does not detect the presence of other reducing substance present in the sample. You can say it has that method has analytical specificity for detecting only glucose in the sample. While if you take an example, follicle method, that is not specific method because it is giving positive by all the reducing substances presented in the sample. So that is not that much specific compared to means. So that is not specific method, and glucose oxidase peroxidase is the specific method for glucose estimation. So this is the difference between analytical sensitivity and specificity. Next, what is the diagnostic specificity? It is the ability of the test be corrected, identified those with the disease, means the patient who are having a disease, and if any test is able to diagnose that, it is called as sensitivity. It shows us the true positivity, that is, it is the indicator of true positive rate. Specificity is the ability of the test to correctly identify those without disease, means if anyone does not have disease, if the test is able to identify it, that means if it is giving negative result in the patient who does not have the disease, then it is called as the test is specific because it is the indicator of true negative rate. So this is the difference between diagnostic sensitivity and diagnostic specificity. And next we want to discuss two different type of quality control. One is internal quality control, another one is external quality control. External quality control is also called as ProPhysy testing or external quality assessment. What is the internal quality control? It is a daily process. In this routine laboratory test are acid and evaluated on the daily basics, and this is done by using quality control material. The concentration of analyte in the quality control material is known as quality control material is done before the processing of that patient sample, and the result of quality control material that we get in it is a cross checked with the result that we already known to us, and it done on daily basics. If internal quality control result are within the specific range that is given by that manufacturer, so these results are then used to validate whether the patient result are reliable or not. And once the test system is validated, patient result can be used for diagnosis, prognosis, and treatment. So the internal quality control is a measures of precision, and by definition of IAM, internal quality control refer to the set of procedure undertaken by the laboratory staff for the continuous and immediate monitoring of that laboratory work in order to decide whether the result is reliable enough to be released or not. Quality control, or it is also called as that external quality control, also called as external quality assessment. It is done by some external outside agency. This one done by external outside agencies. It is done by some external outside agency, and it is used to evaluate your laboratory performance with reference to other participant laboratory means it is for the inter-laboratory comparisons. For example, if I am getting result of a particular test in my lab, so they are comparable with the result of that other lab. If I want to test, then I have to use that external quality assessment scheme. So this system allow that comparison of laboratory testing to source of outside laboratory. Let's try to understand how that external quality assessment scheme works. So there is 1/3 outside agency which is called as equal provided, whereas some provider like CMC, Vellore, this RADAS inter-quality assessment scheme, by-road scheme in a hospital, in our hospital clinical biochemistry laboratory use two equal scheme, that is CMC, Vellore, and Requas. If we want to use that the result of our laboratory or compare with the other laboratory having using the same method and same instrument, whether inter laboratory comparison or not, whether our result are accurate or not, so we get involved in this Requas program. So the request provided sent us the external quality control sample, and the result or the concentration analytes is not known to us. We analyze or process these sample as our patient sample at the end of or during the last week of every month, and then we feed the result in a website of equals provided. So the result from all the laboratory goes to request provided, and then when they analyze report, they calculate that means and various statistic like standard deviation index, target score, then they send us to that report, and based on that report we come to know that whether our tests are accurate or not, whether our the internal quality control program accurate or not. External quality assessment, that is EQA, refer to a system in which the performance of a laboratory is assessed periodically and retrospectively. Because we process the external quality control samples in the last month of a month, we send the result to that external agency, and then we get a report, and we get to know that IQZ status of our laboratory over the period of that particular month, and it is done by independent outside agency. For example, Biorats CMC Vellore requires to indicate the laboratory staff whether there may be shortcomings, and hence indicate the need for improving or changing IQC procedure. So by this report of external quality control, we come to know that whether our result were accurate or not, and then depending upon the result we can change our internal quality controls strategies. Now let's talk about types of errors. There are two types of error. One is systemic error and the second one is a random error. Systemic error, that error that affect the every test in constant predictable manner. Random error are due to lack of reproducibility, and these are the error that affect individual samples in a random and unpredictable manner. Next, what are the causes of error? What are the causes of systematic error? The systematic error are due to the deterioration of instruments light source. Second one is gradual accumulation of debris in samples or reagent tubings. Third one, the reagent are deteriorate or they are if there is aging of reagent. Fourth one is if there is a gradual deterioration of control materials, if there is gradual deterioration of incubation chamber temperature in case of enzyme estimation, or if there is gradual deterioration of calibration. So all these can, or these are other various reason, but these are important reason which result into the systematic error. Coming to the causes of random error. Random errors, if there is improperly mixed or dissolved reagent, or if there is an air bubbles in reagent, or reagent lines, sampling or reagent syringes, if pipette tips is not fitting properly, or if there is clot in pipette, if the temperature and incubation is unstable, or if there is unstable power supply, poor operator technique, improper mixing of process sample, incorrect reconstitution of that controlled material. So all these result into the random error. Incorrect reconstitution of controlled material. Thanks for watching.